Hi, my name is Noorja and I'm studying in second year in Bachelor of Physiotherapy from Marwadi University. So, today I'm going to explain mechanism of action of interferential therapy in electrotherapy. So, let's start. So, first, what is the definition of interferential therapy? So, interferential therapy utilizes two medium frequency current which pass through the tissue simultaneously. Means IFT have two medium. From two different medium frequency current passes through the skin and tissue. When two medium frequency current pass through the skin at a point, these two medium frequency current interfere, means they will superimpose to each other. This interference give rise to an bit frequency, which has the characteristics of low frequency stimulation. Means in IFT have two medium frequency current, two medium. From that two different medium frequency current are passing, and at a point they will interfere and superimpose to each other, and from that bit frequency will rise. IFT have high frequency current and the skin have to resist low. So that the reason the characteristic have low frequency stimulation. In bit frequency, amplitude will rise and slow. So it is called amplitude modulated frequency. So in this picture you can see two different medium. From that a different frequency current passing and bit frequency is rising, and inside the bit frequency amplitude modulated frequency are sudden rising and sudden slow. Now we will see how IFT penetrate depth of the skin. IFT have high frequency and skin have to resist low. So in IFT, two medium frequency current have high frequency, so it will penetrate depth of the skin. So this is the production of IFT. So there are four different mediums. From one medium, 4000 Hz frequency current is passing. In medium 1, we have to keep exact frequency. In another medium, we have to adjust the frequency current. So we are keeping we have to keep from 4000 to between 4000 to 4200 hertz. So we are keeping 4100 hertz. Okay, and these two frequency current are interfere at a 90 degree, and bit frequency current is rising at a 45 degree. So this will so like this in medium 3 and medium 4 will happen. So it will turn into clover leaf pattern. Now we will see how we can calculate bit frequency. So there is a formula, f1 plus f2 divided by 2. So 4000 plus 4100 hertz, 4100 hertz divided by 2. So we are getting 4050 hertz. Now there is a formula that we can calculate how much amplitude inside the bit frequency. So f2 minus f1 means 4100 minus 4000, we are getting 100 hertz. So this was production of IFT. So now we will see inside the bit frequency, amplitude was sudden rising and sudden going slow. So if the wave are exact on the another exact means exact same wave, so it will turn into constructive phase. If the waves are different, means starting from else and ending from elsewhere, so it will turn into destructive phase. Now technique of IFT. So there are three technique of IFT we can apply on the patient, means bipolar, quadripolar 45 and quadripolar 90. Bipolar we are using for smaller area like elbow joint, ankle joint, knee joint. We are using bipolar. In bipolar, there is a one channel and two electrode. Quadripolar 45 also we are using for smaller area, but in that we are using two channel and four electrode. Quadripolar 90 we are using for larger areas like back, thighs. So quadripolar 90 we are using for larger area. In that two channel and four electrode. Now we will see frequency. In frequency there are three terminologies: base, spectrum and sweep. Base means starting number of range. Spectrum means difference of range, and sweep means the whole range. Example, 90 to 100 frequency. So 90 will be base. The difference is 10%, 10. So 10 will be our spectrum, and 90 to 100, the whole range, is our sweep. So there are three waveforms we are using in IFT: triangular, trapezoid and rectangular. Triangular waveform we are using for acute condition, means new pain. Trapezoid waveform we are using for subacute condition. Subacute means there is not an exact definition. Subacute means 7 days pain older, 1 week older pain. Rectangular waveform we are using for chronic condition, means 1 month older. Now, physiological effects. Pain relief through gate control theory inhibits pain signal transmission at the spinal cord level, encourages release of endorphins, body's natural painkillers. Second, muscle relaxation, reduce spasm by stimulating motor nerves. Improved blood flow promotes oxygen and nutrients delivery to the tissues. Reduction in swelling, enhance lymphatic drainage and fluid movement. Indication: in which condition we can use IFT? In pain relief, sprain, strain, tendinitis. Delayed union means after fracture we can use IFT. Pseudoarthrosis, muscle re-education. Contraindication means uh, in the condition we cannot use IFT, like in acute sepsis, means chances of increase of infection, spread of infection, large open wounds, pregnancy because of uterus contraction, cardiac disease, pacemaker, danger, uh, burn, main current shock faulty equipment, dizziness and headache. After taking IFT, may or may not the patient feel dizziness and headache also. So thank you.